Opioid addiction is a national public health crisis that affects individuals and families regardless of their age, race, or income. The statistics are overwhelming. More than 130 people die from opioid addiction every day. But there is hope. Recovery is possible. This podcast is for informational purposes only and should not replace advice from a medical provider when making healthcare decisions. This podcast contains opinionated content and may not reflect the opinions of any organizations this podcast is affiliated with. We will discuss opioid use, opioid treatment, and physical and psychological trauma, which may be triggering for some listeners. Listener discretion is advised. Today on Someone You Know, we are speaking with Susan, Rosa, and Janneza, employees at Esperanza Health Center in the Kensington neighborhood of Philadelphia. Esperanza, which is Spanish for hope, is a multicultural ministry providing holistic health care to the Latino and underserved communities of Philadelphia. Both Rosa and Janneza grew up in Kensington and are now working tirelessly to restore the beauty of their neighborhood. This episode explores the role of destigmatizing addiction in community health and the importance of culturally competent care when providing substance use disorder treatment and services. Esperanza is open Monday through Friday, 8:30 to 5 p.m., and will be opening a brand new state-of-the-art healthcare facility on September 30th. For more information on Esperanza, visit esperanzahealth.com. I'm your host, Heather Major, and this is Someone You Know. We're very fortunate today to have you all join us. I think what's important is for our audience to hear is a little bit more about the organization and the work that you're doing. And then I want to explore a little bit more about Kensington. So if we could, Susan, I'll look to you to sort of give us an overview. You've been with Esperanza for 14 years. Can you give us an overview of the organization and its growth and its vision?
So Esperanza was started actually 30 years ago. We're celebrating our 30th anniversary by one doctor who was concerned about the health of Philadelphia. And when she looked around, she saw that there was a certain areas of Philadelphia that didn't have enough physicians. Physicians work maybe in Center City or in the suburbs, but then there's this kind of parts of Philadelphia, mostly where poor people live, where there weren't enough doctors serving patients. So she decided she wanted to try to meet needs of the people that don't have enough services. So she decided to begin a health center in North Philly. And she also saw that there was a large Spanish-speaking population who had special barriers to care because they spoke Spanish, and they couldn't find clinicians who understood exactly what they were talking about. So she learned Spanish, and she opened up Esperanza Health Center in North Philly. We're a faith-based organization, so we do a lot of collaboration and connection with the churches in the community. And churches are really the places that a lot of the community gathers. It's a lot of where life happens. It's a good place to engage people in a more holistic way. What Esperanza is trying to do is reach into our community and look at all the things that are surrounding a patient and try to meet them with the physical, emotional, spiritual, and even social complexities of their lives and bring them to health.
Can you tell us a little bit about what is a widely known area for drug use and the exchange of drugs? Tell us a little bit more about how that impacts people on a day-to-day basis, being that you're from Kensington and you see it and you grow up with it and you address it in your work and in your personal lives.
I grew up on D and Allegheny, and I spent a lot of time in Kensington just kind of wondering where did we go wrong?
Mm-hmm.
I remember being a young girl, 14, 15, working, and one of my favorite things was to go cash my check and go walk Kensington up and down so that I could go shopping because it was right underneath the L, and we would get our sneakers there and our clothing there. And now I feel like there's a lot of pain that people are afraid to speak about. And so I love the fact that I live there and I get to work there and I get to tell people that I am a living and active person that it could be different. That we don't have to submit ourselves to not talking about mental health, about whatever it is that there's this shame or embarrassment about. Because at one point, all of these people under the L, they were someone's child, someone's father, brother, sister, aunt, and uncle. And I often think about my family, and when I look at them, I think about my brother. I think about my uncles and aunts who didn't survive it. And I hope to continue to represent hope, represent Esperanza in a way that shows respect, kindness, love, dignity, no matter what the situation is or what the circumstances are. But I wonder about that person's parent, that person's kid. We're not just trying to care for the person who shows up to get Suboxone, but we're trying to care for the entire family. Like, okay, where are your kids? Are they ready for school? Do they have uniforms? Do they have pencils? And if they don't, then we make it our business to say, okay, we'll come back on this day because we're gonna get you what you don't have. Or we're gonna keep talking about how can we improve? What areas are we lacking in? Because we recognize that we can't do this alone. This is a huge monster. It's so complex. There's so many layers and layers of issues. But I think that if we all collectively make a decision to be in it wholeheartedly and to do what is right and to bring and attract others to come and help us, we'll make a difference, a small difference. It could be, smiling at a young child and looking at them and saying it's gonna be okay. But one life matters, every life matters. And I think that's our goal, that's our intention.
I guess for me, I also grew up in the community. Every morning I wake up and I ask God, I said, let me see the things the way you see it. And when I leave from our parking lot, is like 2 blocks from the clinic, and I set a mission that I'm gonna see something beautiful. And even if it's just someone laying in the ground, I wanna look at that person as that's somebody's child. That could be my daughter. And I pray, and sometimes when you see it every day, I've been walking from this parking lot to this clinic for the past 10 years. And after a while, you can become like, this is the norm, but it is not normal. And I want to see things the way God sees them. And I want to be able to be hopeful, even if the person next to me is not. So I think for me, I was born in the community. I grew up in the community. I have a daughter that's 20 years old and a son that's 15 years old that I also brought up in the community. And my daughter goes to Drexel University, and that's just, to me, there is hope that even though you may have grown up in this neighborhood and you may have seen these things, there's still chance. The one thing that we lack in the community is the resources and the person that can come beside you and say, no, you can. And I feel like that's something that I was able to provide for my children. So why not provide it to those kids that are coming in with a medical appointment? Why not provide it to that mother that may be feeling like she's in this by herself? No, you can. You can raise these children. You can go to college. You can. There is hope and there is opportunities out there. And if I can continue to do that, then, and if that's what I've been called to do, then I'm gonna do it.
I think also from what you're saying, I feel like isolation is one of the things that causes a lot of difficulties in our community. And sometimes isolation comes because somebody's been drawn into an addiction or parents have not been able to be fully present with their children. So how do we address isolation? And that's where I feel like Esperanza does have something to bring. Can we bring people together? And maybe it's not us fulfilling the isolation, but it's a peer of theirs that's also struggling with the same thing, medically or spiritually or emotionally. So I feel like there's a lot of strengths in the community. So if Esperanza can be part of bringing those strengths together, or if we can walk alongside our patient so that they know they're not alone and what they have inside them they can use to become healthy themselves or to help their children be healthy or to have a future. There's just such a sense of today is all that matters, because people feel alone, people feel like there's no future, and that is why I'm glad we're called Esperanza, and we're thinking about hope, because we want to say to people, you have it available to you to go further, and we will want to walk alongside you in that, whatever that takes.
One of the things that I think our listeners are going to want to know is how you address substance use disorder in the community. Could you give us a little bit of an idea of the types of services and supports that Esperanza is prepared or is offering to its community for those who are either the individual who has active addiction, is looking to get into treatment, or the family and friends who are looking to support them?
So one of the ways that we are helping the community with the substance use is by prescribing Suboxone. So they come up when they're ready for treatment. Depending where they are in their addiction, we will do an intake process, and then they come to group once a week. So in that group, there's a substance use counselor who will do a little lesson. They get to see the provider. We check their urines to make sure that they are actually taking the Suboxone. And so they get to join a group, and they are in that group once a week until for several weeks, and then they would go to every other week and then once a month. But the beauty of them being on Suboxone is that because they have to go get their script and do it at home, they get to take ownership of their recovery. And we get to see that every week by their urine levels, and some have been very successful where we've had to transfer out and say, hey, now you can get to go somewhere a little bit closer to your house, or you don't need to come now as often. And so it's only been about 22 patients altogether that have come through the entire process, which has been great. And so a lot of the people there know that we have this program, and when you're serious, when you're ready, we can help you transition.
Do you want to tell us a little bit more about how Suboxone works and why you're seeing success in the population that you're serving who is using Suboxone?
So I think why it works is that because the patient gets to decide when they're going to take it. It's right before they feel that urge of wanting to use heroin or whatever they're struggling with at that particular moment. And then it stays in their system for a number of hours. And so they're able at that particular moment to overcome that sensation. And so that's part of them taking responsibility for their recovery. So I feel like that's why it works, because they have to participate in it. It's not someone else injecting them with something. It's not, they're not going to an in-center. They're doing it at their house, wherever they are living. So it's in the comfort of their own space.
It's not great to ever be addicted to anything, but as your addiction is a stronger one, I feel like the view of society toward you, becomes worse and worse. And in some ways, I think the heroin addict, because you think I'll never be a heroin addict, you have a bad view of people that are on opioids. But because actually a lot of people are becoming addicted, unfortunately, to opioid medications, there is a little bit of a different view of that in the world now, because it can be your brother, it could be your sister, it could be your mother, who have become addicted to painkillers. I think when it looks like heroin and it's in a poor community, there's more of a stigma to it. But I also feel like because it's such a strong addiction, because it's very hard to get over, because it's extremely incapacitating, people tend to have a negative view toward the person who has that addiction.
I think one of the stigmas that can be removed is that the opioid addiction is only for the poor, because it's Kensington. But the realization is that it's not just for the poor, and it's not just Latinos, and it's not just African Americans, but it's everybody. And people are traveling from different parts of the states with this issue. And so I think the more we educate when we prescribe, the more we walk along those who are struggling, we get to really learn where did this all start? What was your journey like, right? Because if I am a mom to a 17-year-old who is in a sport and my child now is injured and is prescribed something irresponsibly, and I don't really understand or have the literacy or the education to understand what all the side effects are, then I end up with my now 20-year-old because I didn't know that they struggled for 3 years. This happens to all of our children, no matter what neighborhood. It just so happens that Kensington is glamorized as the place to go once you can't get it legally. No matter how many times you've tried, keep trying, keep coming, keep showing up. We're gonna have our doors open, we're gonna listen, we're gonna treat you, we're gonna respect you. And I would say that it is okay to speak about the hard stuff. Not just that you are in this addiction right now, but what were the roots, what were the problems, what happened along the way? So how do we come alongside you and deal with treating your mental health or treating, the fact that there's all of this wounds and pain and suffering that you haven't been really able, or you haven't had the freedom to speak about. Where I think as Esperanza, we're saying, no, we want to hear all the ugly stuff so that we can get to all the good stuff.
This is why we do what we do every day. This is why we wake up, we go into Esperanza, we serve, because we want you to know that you are worth it and there is hope. There's nothing too big that you cannot accomplish. And if you give us the opportunity, we are here and we want to be able to help you with whatever your struggle is. And believe me, it's not too big and it's not too late.
I think shared experience is a really powerful connector for people. And you didn't have to go through the exact same experience, but if there's a part of your life, your experience that's you can relate to another, or someone can relate to you, that is a very powerful connector of people, and that helps to build the cohesion and trust that is so difficult, particularly in communities that are, historically marginalized and underserved. And then you add in the cultural sensitivities of communities, where you had mentioned, Rosa, about how the Latino community is very proud. It's hard to break down. No one wants to give up their pride. You should be proud, but how can you be proud and still be able to ask for help? And that can be a very humbling experience. But knowing that someone else has sort of walked, in that same path, along that same journey, it's a tremendously powerful connector. And you all do it so well. Susan, I know that you are deeply appreciative for the staff that you have and the people that you get to work with every day. And I feel like every time I sit down with you or anyone from your team, I get to learn something else about just the layers and the care and the compassion that goes into all that you do, whether it's from greeting someone at the front door to the engagement after the appointment, to listening to a patient who may be coming in not mad at you, like you had said, Janneza, but just having a bad day. People have bad days, and I can only imagine when you're facing a complexity of issues in your life, you probably have more bad days than good. So yeah, having someone who wants to listen and listen compassionately is a big deal. You all are doing work that goes far beyond what I think is the traditional sense of healthcare. And you've been doing this for a while, so this is not new. But how do you think it's being received by the community?
I feel we're trying, as we engage, even with what we're going to do in this new building, trying to engage with the community. I think we've been in it long enough that we know that we'll succeed at it best if we're trying to engage the community in what they think is the next thing that they need. So what we're now doing is just trying to listen as much as we can and going out and engaging our community and asking them what they think. And I've been very encouraged by them because they're very excited when they see this building. I think even just building this building in that place in Kensington with a big budget, to make it look as beautiful as possible. It shows respect to them. I think it shows hope. Hope that there is a future for them and for us. We're together in this. I feel like that partnership with the community, where they think they have something to add to what Esperanza is doing, is really important and vital. And we hear a lot of that. And I know for me, it's extremely gratifying to be working with the community and asking them, does this look right to you? And having them say yes, or let's change it up a little bit. And we're willing to give that a shot. And so I feel a lot of joy actually from watching the community engage with us. They're sort of saying to us, go for it. And I think that there's something really wonderful about that.
The joy and when, I think that is an emotion that I don't think a lot of people would associate with Kensington, right? You think of Kensington, you automatically have some sort of thought that comes to your mind based on what you've read or what you've seen or what you've experienced. But joy is a beautiful emotion, and I love that that's what you feel, because that's not. I don't think that is what people expect to hear or expect to feel. But I felt it when we visited, and I know that you get to feel it, despite what might be going on around, and you can't control all things and all the things that are happening. But you can pull that. You can still always go back to that joy, and hopefully that's not a fleeting feeling for you.
I think the community is excited. The community, they're listening to our patients. You hear, we're moving. They're included. It's not Esperanza's moving. It's we are moving. My doctor, they're involved as much as we're involved in it. One of the things that we're doing in the new building is called the Wall of Faith. And we're asking people from the community to submit pictures of them so we can create this mural. And it's not going to be only of Esperanza, but it's going to be of the community. And we want them to be involved. So I think they're excited because they know that it's not only about Esperanza, but it's about us. And we're doing this together. And they watch our building. They come into the office and they tell us everything that happened over the weekend. They tell us who it was, what they had on, and and it's exciting because they have taken this ownership of this place because they know that, one, we're going to provide services that for them, but two, this is going to bring value into their community and into the family. The same way we're caring for them, they're caring for us. So it's a partnership with the community.
I think about a seniors group, and I think about a garden where we can plant sofrito, right? Because that's what we use to cook. In the Latino culture, if you don't have sofrito, you're not allowed to cook. But I am excited about the possibilities of them, planting and gardening and green space. And just the fact that you can come get coffee without an appointment, right? You can still get your lunch there. I'm excited about exercise at free if you're a patient, right? Our gym that's coming. That's unheard of in Kensington, right? There's nowhere for you to de-stress, right? And I'm excited about that fact that we will be able to do that for our kids, our seniors who are so fragile, our single moms, our single dads. And I'm just excited about, the things that we haven't even thought of, really, because I think we'll have more opportunities to think big and think outside of what we have. But a lot of that will come from us listening to what the neighborhood wants, right? And getting buy-in and commitments, which I think is important. It's important to just not add services, but it's important to ask, what is it that you want to see in your neighborhood? And if there's a way that we can do that, I think we will, and I think we'll do it well.
I want to thank you all for being here today. I think this has been a tremendously helpful discussion and conversation, and just know that we at the foundation truly do appreciate not only your willingness to be here today to share with us your experience and all the great work that you're doing in Kensington and beyond for the Kensington community, but also just for being here and wanting to continue the conversation around opioid use disorder, stigma, and just making our communities a healthier place.
you. It's been a joy for us to be here today. I just don't want to end this without a little bit of a gratitude and thank you to the Independence Foundation. As we talked before about partnerships, I feel like there's a certain level of partnership that we need within the Kensington community, but we also need partnerships that go outside of our little neighborhood. And I feel like we're very grateful for you to have an interest, and for you to be concerned about Kensington is a really big deal. I feel like there is a million miles between this building and Kensington, and us on a certain socio-economic level. And so it's things starting here and partnering with us in Kensington that I think are going to make the real difference. So I want to thank you for that and tell you how much we appreciate that.
If you or someone you know is suffering from opioid addiction, please visit ibxfoundation.org/SYK. The link is in our show notes below.